So we're going to give some time for everybody to get on in just a few minutes. As you can see, I'm sitting here with this beautiful, beautiful young lady that I've known for a long time. We'll talk about that in a minute. But this is Dr. Valerie Callender. How long have I known you?
Oh, probably 30 years.
30 years, oh my God.
Oh,
see
we're
how
telling
young she
our
looks.
age.
I know. That's why we got to come here.
You didn't
That's
hear
why we
that.
got. So I see people logging on. If you all can see us okay and everything is coming in clear, do me a favor. Just hit the hearts. We'll see the hearts. If you could do me a quick favor, if we're coming in clear. Hello, Kiki. Uh-oh, I see somebody put a thumbs up. Uh-oh, I see the thumbs coming up.
That's great.
Isn't that great? Isn't this crazy how this stuff is just live? Awesome. Okay, so we're giving some people some time to cover. We're not going to hold you all too long today because Dr. Calender is actually here on a Sunday. Can you believe that? She is joining us on a Sunday afternoon.
And welcome to my office.
Did you all see the pictures on Facebook of her office? 10,000, is it 10,000?
10,000 square feet.
10,000 square feet of nothing but dermatology. Dermatology. So I'm super excited. So we're going to go ahead and get started. The reason why we're going to get started right now, people can log in and see this video, this live feed later, but we're on a tight schedule. She's here on the weekend, and I just want to get her in and out so she can enjoy the rest of her day with her family. So just quickly, tell everybody about yourself and tell everybody where you're from and how you got started in this industry and that type of thing.
Okay. Well, I am originally from Massachusetts, Worcester, so you might hear a little accent every now and then. But I did my medical school training at Howard University in Washington, D.C.
Ah, okay.
And I did my medical school training, internship, as well as dermatology here at Howard. Currently, I am professor of dermatology at Howard University.
Did you all hear that? She's a professor at Howard University of dermatology. Go ahead, I'm sorry.
Yes, but my main job is I'm the medical director here at the Calender Dermatology and Cosmetic Center.
Okay.
And so what we do is we specialize not only in medical dermatology and surgical dermatology, but we also do aesthetics. And we do clinical research to show safety in skin and hair products, as well as we treat many, many, many patients with hair loss. And I think that's what we're here today, to talk about hair loss.
Yes, ma'am. One of the interesting things, the reason why I wanted to call Dr. Calender, because I've known her for years, I know her work and I know her history. The reason why I called her, because I know that this is some of the things that she specializes in. Not just skin, not just anti-aging, but in hair loss. And she's done a lot of studies over the years with hair loss. And so she's going to have a lot of answers for you today. As a matter of fact, before we logged on today, she told me we could do a question and answer. So I'm excited about that. We had not planned that, but the fact that she's going to allow us to do that, I'm excited. So the reason, as you know, I'm not a medical doctor. I'm a trichologist. I'm a licensed cosmetologist. But this is a medical doctor, MD dermatologist. This is a doctor. And so a lot of the issues that I see on a regular basis, she's familiar with. And she can talk about them because she knows what goes on and what are the effects of hair loss, what causes them, some of the, you've done studies.
Absolutely.
Tell us about some of the studies that you've done over the years with hair loss and that type of thing.
Well, we basically look at prescription medications, and we also look at actually procedures to regrow hair. And so one of the hallmark products, and I'm pretty sure you've heard of topical minoxidil or Rogaine. We did the clinical studies to show safety of Rogaine 5% foam in the treatment of women used once daily. As we know now, Rogaine is over the counter, so you can get it, but there's different strengths. There's a 2% and there's a 5%. Okay. In the past, only 2% was for women and 5% was for male. And so now the males have 5%, but now the females, we have 5% as well. And it works very well. And we don't have to do it twice a day. The clinical studies actually showed that there was efficacy and hair regrowth for women who only suffer with female pattern hair loss.
Female pattern hair loss.
Hereditary hair loss.
Which is female pattern baldness.
And the other term that you'll hear about is androgenetic alopecia. So all that means hereditary hair loss. So minoxidil is the treatment of choice for that condition, and we did the clinical studies to show not only that it's efficacious and it works, but also that it's safe. and the side effect profile is very low.
Now, let me ask you a quick question. You were talking about medications. I get a lot of people in my clinic that are on high blood pressure medication. There are some that are on thyroid medication, and we have found that often sometimes that changes the texture of the hair. It also it can cause hair breakage, and the texture becomes a little bit more dry and those sorts of things. Can you talk a little bit about that?
I mean, any medication, if you look at the side effect profile, hair loss is always listed somewhere there. There are certain medications where hair loss is more common, and we see it very frequently, but then any medication can cause hair loss. The one thing that's difficult is that there's no diagnostic test that tells you that, yes, it's this medication versus this one. Say you're on a list of like 10, 15 meds. Hopefully you're not, but if you tend to be on a lot of different medications, there's no test that tells you it's, you know, your high blood pressure medicine more so than it's your medicine that controls your arthritis. So the problem is that a lot of times you just have to, you know, work with you as a trichologist. The breakage part is important, the good hair grooming, moisturize, and then there are other things that we can do to help to slow down the hair loss. Because you don't want to stop your medicines, and you never do that unless you talk to your primary care physician.
And I think what a lot of people, what I see is that people always try to self-diagnose themselves, and they try to do their treatments and services at home. Hit on the importance of going to a professional, a licensed professional. You know, I call a lot of people YouTube license earners, and they go to YouTube and think that they can do what we do or what you do.
And I call it Dr. Google.
Right, Dr. Google, exactly. Exactly. Talk about that, because I think we have a hard time with understanding that there are professionals that have learned this craft or have gone to school in the medical industry or the medical field to know these things.
And that's why it's important as a dermatologist and a trichologist that we work together, because there are certain hair loss conditions that needs to be diagnosed by a dermatologist.
Absolutely.
And sometimes we even have to do blood testing. Sometimes we actually have to do a scalp biopsy where we numb the scalp, take a small piece, examine the hair and the follicles under the microscope to come up with a diagnosis. Because if you think about it, you know, when males have hair loss, it's very easy. They have male pattern hair loss, which is also androgenetic alopecia. And so they're pretty easy. But women, we're a little bit more complicated. We can have several forms of hair loss going on at the same time, and each one is treated differently. So if you are going by, you know, YouTube or a picture that you saw on the internet and said, oh, that looks like my hair loss, you may be wrong, and you really need to have your dermatologist who specializes in hair to take a look and determine what your cause is. And then also with the trichologist, you know, we tend to do hair care at home, and sometimes you need to be in the salon having your chemical treatments done, the moisture content being analyzed, and you can't really do that. I mean, that's what Keith, you do.
Yes, ma'am. Yes,
you know about the moisture content and hair breakage and brittle, because that's a very common condition that we term trichorexis nodosa, which just means hair breakage. And there's no prescription medicine for that. It's all you.
Absolutely. And again, when they leave you all, the dermatologist, you all go home and you seem to think that you could do these things yourself. Prime example, and she and I were talking about this earlier, when it comes to relaxers and chemicals and colors. Let's tap on that for a minute. So there's this fad that's going on right now. There's a couple of fads. One, let's talk about relaxers. People seem to think that they can't get relaxers anymore, or they seem to think they have to go natural, or they seem to think, you know, they've taken it upon themselves to do the big cut. But there's several issues on those decisions where you would come to those conclusions. Can you talk about that, so we can take away the what we call rumors,
myths
and
misconceptions,
or looking at Chris Rock in his movie talking about the creamy cracker. Remember that? And that became a huge phase. It's just been crazy. So I want you to hear it from, and then there are some people that are, and some doctors that are saying that relaxers and chemicals and colors cause tumors. Can you hit on some of this stuff just to give people some insight and education on that?
Yes, I would be glad to. The first thing I would say is that there's a form of hair loss that we do not know the cause of it, called central centrifugal cicatricial alopecia. We just say CCCA for short.
Yes,
but
ma'am.
we don't know the cause of it. It has been associated with hot combs in the past, and we used to call it hot comb alopecia. And then we thought it was due to relaxers, and so that's kind of where some of this has you know, come to fruition as far as relaxers and hair.
Did you hear what she said? They thought. Go ahead, I'm sorry.
First it was heat,
Right.
then it was relaxers,
Right.
and then we found there were women who were always natural, that never had a perm, never had a relaxer, never hot combed their hair, and they also developed CCCA. So again, there's most likely some genetic predisposition, and so it doesn't occur in everyone. And so there are some individuals who can get relaxers, but then those who come in our office who are suffering from scarring, inflammatory CCCA, this hair loss that's permanent, those patients may not want to do any traumatic hairstyles, so no tight braids, no glues from weaves, using glues and weaves, and some of them might want to avoid laxers and go natural, but it's not for everyone. And those who do not suffer with these medical conditions, these hair loss conditions, relaxers are fine as long as it's done in a professional setting.
Absolutely.
And it's done properly.
Yes.
And I always have ladies come in and ask, you know, look at my scalp, and is it okay if I get a relaxer? And I have to tell them that I can't give you an A-okay. I'm not standing over you while you're doing it at home yourself with these at-home no-lie relaxers. Or somebody else is doing it that I know may or may not have the technical experience. So if you find someone who is knowledgeable about hair, and usually they'll be a trichologist, I think it's fine to do a relaxer. So, you know, I don't think ladies have to give it up altogether, but you have to find out what works well for you. And if natural styles work well for you, then that's fine. If relaxers work well and you have a professional to do it for you, I think it's fine.
Now, tapping on towards the end, has there been studies about tumors and the thyroid and people saying that it causes cancer and all that kind of stuff? Can you tap on that a little bit?
There have been no cases that I am aware of, any published data that shows that topical relaxers cause cancer.
Did you hear that? Did you hear that?
And there are no published studies. I have no patients who've had developed cancer from relaxers, and that's what I go by. I know that is, you can find this information on the internet.
Yes, ma'am.
I think it's the Environmental Working Group who has put out data. But I'll tell you, I have not seen any patients suffer from cancer from relaxers, and I can't give you a clinical study that's well developed, placebo controlled, thousands and thousands of patients, and looked at them over the years to see who has developed cancer or not.
Absolutely.
No well done studies.
And I want you all to know that we're also talking to all of you, people from, and I don't want you to think this is about one skin type, one hair type. We're talking about people that are black, white, Korean, everybody has hair. And so we're talking about people, those of you who get color, those of you who get any type of chemicals. What she's saying is she has not seen any studies that state that there's a result of getting tumors or cancer or anything of that nature from chemicals. We haven't seen now hair chemicals. But what we do see is people who their hair and scalp is getting damaged from people trying to do their own hair and professionals that aren't doing the right thing. And do you see a lot of that?
Yes, I do. Yes, I do. And I will say though that things are changing and things are getting better. At first, when we started evaluating women with hair loss, we would get them at the very end. So when you look at a spectrum of early diagnosis and late diagnosis, we were getting patients more on the late side. And once the hair loss has been going on for long periods of time, a lot of time that's permanent. So now I will say that the stylists are being educated more so on hair and scalp disorders, and they're identifying hair loss, you know, early and sending them to the dermatologist. So I will say that things are getting better, and so it's not dismal. Okay, things are getting better.
Right.
And you think about it. Do you know what your scalp looks like?
Right, absolutely.
I don't know. I can't see my scalp. I don't know. So we rely on
the professionals.
Our stylists, to tell us, our trichologists, our dermatologists, to examine our scalp. And so I think things are on the upswing, and I think things are getting better.
See, now again, and it's about education. As a matter of fact, she's doing a seminar on May 25th.
Yes.
On hair loss and services that her center offers for hair loss. So if you all are in the DMV area and you want to come to the seminar, do they need to call here and register?
Oh, yes.
Okay, so
RSVP.
you need to RSVP, and she'll tell you the telephone number real quick too.
301-249-0970.
As a matter of fact, I'm going to try to come myself because I want to be a part of that.
Good.
Y'all got to come and see it. So now let's talk about issues with people that are using weaving, hair pieces, wigs. We're seeing a lot of people that are applying their own wigs and things of that nature, and the hair is thinning out around the edges. You're going to tell them what that's called because I want them to hear it from her. I want you to hear it from her because she sees this all the time, and the permanent damage that it's causing, people doing their own thing, going to these beauty supply stores thinking they could do what our professional licensed cosmetologists do. And then they find later on that they're doing more damage than good. They're so focused on looking good, but then it gets worse.
Yeah. We see a lot of alopecia or traction alopecia. And it's usually a result of tight ponytails, tight braids, tight weaves, because weaves are sewn in.
Yes, ma'am.
And so we do see a lot of that. And so it's difficult because, mainly women do these styles because it's low maintenance, as well as they don't have to wash their hair as frequently when their hair is braided up. But the problem is that because of the decreased frequency of washing hair, women of color in particular suffer from seborrheic dermatitis. And seborrheic dermatitis, or dandruff, is caused by an overgrowth of yeast that live in the hair follicles.
Did you hear that? From not washing your hair, an overgrowth of yeast around the hair follicles from you not shampooing your hair or cleaning your hair on the regular basis. I didn't mean to interrupt, but I wanted to make sure that you're hearing this, because you're not hearing it from a trichologist, you're hearing it from a medical doctor. So listen to this. This is very important. And quick, if you know people that need to be listening to this live feed, share right now. Share this live feed with your friends. Tell everybody about that. Celebrity dermatologist Dr. Valerie Callender is here taking time on a Sunday to spend time with you. So share this if you will. Now, if you all can hear us okay, just make sure, can I just see some hearts, or can I see some hands? Oh, you can hear us okay, great. That's what, isn't that crazy? Okay, great. So I'm sorry, go ahead, I interrupted you.
Well, I started talking about seborrheic dermatitis because it's very, very common in women who wash their hair less frequently. As a dermatologist, we recommend at least washing your hair once a week or every 2 weeks. The scalp needs to be clean. And a lot of times what we'll do is we'll recommend a prescription antifungal shampoo in order to kill a lot of that yeast. So you can go once a week or every 2 weeks. It's very difficult for women of color to wash their hair every single day in the shower because of the styling time it takes. So to use an antifungal shampoo is great over the counter. There's Nizoral or ketoconazole shampoo. There's also ZPT or zinc pyrithian type shampoos, and I'm pretty sure you probably have some really good damage shampoos that you recommend. Which ones do you recommend?
Well, we actually, since you recommended it, we have a therapeutic medicated shampoo that we use, which is mentholated. Which we will put, which is by the KeithHarley products, and we'll put it on the hair, shampoo the hair twice, and we let it sit on. So it's literally taking that layer, that surface off of that buildup, and from not washing the hair literally is clean. And one of the things that I'm always talking about to my customers is they're always using oils, petroleum-based oils. And I find that clogs up the hair follicle, and it leaves a coating. And I tell people, you don't always, you know how back in the country, I'm from Greensboro, North Carolina, so you know, back in the country, they were using that thick grease and those heavy things, thinking that was, pomades, thinking that was the best thing. Tell us a little, when you see that when they come in, what do you?
Yeah, and a lot of times, as a dermatologist, we have to prescribe treatment medications, topical cortisones for the itchiness that's associated with seborrheic dermatitis or psoriasis or eczema of the scalp. And the first thing we have to do is ask the patient about the vehicle. You know, what formulation do you like to apply to your scalp? And before, it would always be ointments, and it would be the petrolatum or aquaphor type base in the thick formulations. But now it seems like women like the lighter products on their scalps, so we do have an oil that we recommend that's light, as well as a foam formulation. And then there's some patients who actually like lotions or liquid. So there are alternatives to the thick grease and the ointments and the pomades that we used to recommend. Now I will say though, in the winter time, sometimes those ointments tend to work a lot better. In the winter.
So you hear that? Take notes. In the winter time.
Because not only is your skin extra dry in the winter, but that's your scalp as well as your hair. And some patients do need the extra moisturization that can occur from the ointment or the petrolatum-based products. But that's, you know, some patients.
Now, let me ask you, the skin changes with different seasons. Now, I've always said the skin is connected to the scalp, correct? So the scalp changes with seasons as well, right?
And the hair.
And the hair. So can you talk a little bit about that real quick?
We find that hair breakage or trichorexis nodosa is more common in the winter months because there's no humidity, and you've got to think about it. Humidity in the summer, especially in Washington, D.C., acts as a moisturizer. So in the winter, you don't have that humidity, and the hair tends to be very dry. There's a lot of breakage, and especially here, the nape of the neck. The hair breaks off because it's very dry, and then you get the friction from the collars and the scarves that you wear. So it is a common problem in the winter time, the dryness and the hair breakage. And so when patients come into our office and they're concerned about hair breakage, it's very difficult because you really have to moisturize. And so a lot of times I find telling my patients they need to go to the salon and get you know, the deep conditioning. Can't just do it yourself at home. You need that deep conditioning that you leave on the hair for at least 30 minutes. And then some patients get the steam to help put moisture back in.
That's one of the services we offer. We call
so tell me about that.
We have we have steamers at my clinic, and what we do is we use that to detoxify, moisturize, and to add moisture to the hair itself. And we find that everybody needs this at least once or twice a quarter, because it just lifts everything out and it opens up the follicle, and it also increases hair growth. So we find that the steam really works. And those of you who can't get to a salon or someplace, go into a steam room at your gym, or last but not least, turn your shower on super hot in your bathroom and just walk in there and have something on your scalp, and that will help with the opening of the hair follicles and that type of thing. Does that sound?
Oh yeah, I think you know, anything that you can do to put moisture back into the hair shaft, I mean, it's very important, and that's what helps to prevent breakage.
Awesome. Just we want to tap on real quick. We're not going to keep her too long, but I just want to tap on real quick. Biotin. Tell me what you know about biotin and vitamin D.
Yeah. Well, biotin is a mineral, and it's you know, associated with hair and the growth cycle. We don't tell patients to go out and get biotin for hair. I mean, if it's part of your multivitamin, I think it's fine. I love biotin more for nails. I think it's really good to help strengthen the nails. But a lot of the multivitamins and the hair vitamins that you find actually contain biotin. Now, as far as vitamin D, there's not enough evidence to show that deficiency actually causes hair loss. But we are finding that there are vitamin D receptors on hair follicles, and that is associated.
Say that one more time. There are vitamin D
receptors.
Did you hear that?
Yes. So we know that there is some kind of relationship, and but I'm not sure that we as scientists or physicians know the exact mechanism
Right.
of hair loss and vitamin D deficiency. There are several published studies looking at vitamin D deficiency in alopecia areata, which is an autoimmune condition. But other than that, I think the research is still early, and there's more we need to know.
Okay. Now, we have a lot of, especially in the beauty industry and trichology and that type of thing, we've had a lot of our clients that have had great results from taking biotin that has increased hair growth or something of that nature. And then we have shampoos, and I have a shampoo and conditioner that has biotin in it. So we kind of are hitting it from both ways. What do you think, you're saying that there hasn't been a lot of results from studies, but you're saying it doesn't hurt.
No. Oh,
it doesn't hurt.
Definitely
Okay.
doesn't hurt.
Okay.
I think when you're approaching patients with hair loss,
Yes,
that you tackle it from every single avenue.
Absolutely.
You go at it nutritionally, you use prescription medicines, hair grooming practices. I think this is not just one treatment.
Yes, ma'am.
There are so many different ways to address your patients with hair loss. I mean, even now, the aesthetic treatment for hair loss is a new procedure called platelet-rich plasma, or PRP.
PRP, which is what she's
PRP.
going to be offering here at her center.
Yes.
Tell them what that is.
Oh, well, it's new to dermatology. It's been around in regenerative medicine for long periods of time. Orthopedics used it a lot to stimulate bone and cartilage in patients who have suffered with arthritis and certain other conditions. But now we're finding that PRP is instrumental in hair loss and causing hair regrowth in these patients. And so what happens is that we actually take your blood, and so one tube, and we spin it down, we centrifuge it, and it actually separates the red blood cells and the white blood cells from the plasma. So the plasma is at the top of the tube. We draw that up, and it contains your platelets, a lot of growth factors, cytokines, and these are very important when it comes to hair regrowth. And so you inject it directly into the area of hair loss. And we found with 4 to 5 treatments, and we spread it out every 4 weeks, that it's finding that patients who suffer from female pattern hair loss, as well as traction alopecia, regrowth of the hair. So that's pretty new. And we combined it in between your treatments with laser. And so we use one now called Theradome, and you can kind of Google Theradome, and it's a helmet that has light that actually helps to stimulate.
Yes. Awesome. See, I'm learning something too. I was always wondering about the laser. Does it really work? And I see people hitting the thing, saying, "Oh, this is good information." Okay, and last but not least, and then we're going to go into some questions, and then we're going to let her go for the day. But let's tap on skin. So. We work in salons. I have a trichology clinic, and you work here. You have your center and your dermatology services. I carry a product line. I have a product line, Beauty Control. I got some other things that we carry that we service people with. Tell them about the tap on anti-aging, some of the new products that you can like put on your eyes and your face, and all the peptides and all that kind of stuff. You know, everybody's going crazy and wanting to look young, and then some people are afraid of the needle.
Yes.
I'm one of them. And I don't have Botox, but you can rest assured I'm coming to see her when I decide. But anyway, can you tap on that about using products for skin and some of the things that are out there and that type of thing?
Yeah. Well, we have a cosmetic center. We have probably about 10 different skincare lines that we have. I think what's important for all patients to know is that you have to have a skincare regimen. And you say, well, what does this consist of? I think it's different for everyone. And you have to individualize what your needs are. Because what I need for my skin, you may need something totally different.
Absolutely.
Some patients are concerned with anti-aging, but I tell you, women of color are concerned about even complexion.
Yes.
Having, their skin looking young and even. And you think about it, and I always say this as far as women of color and how we age. And we do age with less wrinkles, but we get problems with pigmentation. We get hyperpigmentation. So I always look at my patients and I look at their face, their neck, and their chest. They should all match. It should be one solid color.
Did you all hear that? Wait a minute. Tap the hearts and tell me if you heard that. She said the chest, the neck, and the face should all match. And that's after you take off the foundation.
That's right. I don't have any.
And she does, look, that's how, look at the hearts right there. But let me tell you, that's how, she doesn't wear foundation. Her skin is always, and it's all matched. Anyway, I don't even want to get there, but go ahead.
So I think the number one thing is to find out, find a good cleanser. And so whether your skin is oily, you need to find one that helps with the oils, an oil control cleanser. If your skin is dry, you need a hydrating cleanser. And so you have to get a good cleanser, and that should be done twice a day.
Get a good cleanser. Did you all hear that? A good cleanser.
And the cleansers don't have to, have benzoyl peroxide and salicylic acid and all this in them. They just need to be able to clean your skin and not leave your skin either too dry or oily. So you need to match your cleanser. Then I think the number one anti-aging product is a good sunscreen. And I think
black and white and correct. Everybody. Did you all hit? Everybody needs to have a good sunscreen.
Yes. Okay. Everyone needs a good sunscreen.
And let me just say, you all, we're not just talking to the women. Guys who are sneaking on there that are watching behind your shoulder of your wife, this is for men too. I'm going to tap on it. I don't want you to think I wasn't thinking about you. So we're going to talk. Look at the guys. Okay, so we are going to tap on the men before we go to the questions, but go ahead.
Okay, yeah, so men and women, you all need a good cleanser and a good sunscreen. So we recommend a sun protection factor or SPF of 30 and higher. Okay. So that should just be your moisturizer. You shouldn't think of it as wearing a sunscreen. Okay. Just think of it as a facial lotion that just happens to have a sunscreen in it. So we definitely recommend that. The job of the sun is to darken skin. So UV light that touches your skin causes wrinkles, it causes pigmentation, it causes skin cancer. So you definitely want to use a sunscreen every day. And I always tell patients that if you do protect yourself from the sun, you also need to have your vitamin D levels checked, because your vitamin D is made in the skin, so you need to be on an oral supplement. And anywhere from 2,000 to 5,000 international units a day is what we recommend. And so you need to have those numbers checked. But we do think that sunscreen is very important in dermatology.
How often, I'm sorry to interrupt you, but how often do you think people should have their blood work done to make sure that they're getting the right nutrients and vitamins and things?
I would probably say that's up to your internist or your family practice physician. But I would say that every 6 months or once a year. I mean, if you suffer from vitamin D deficiency, you may want to check it, at least twice a year. But if it's something that doesn't run in your family or you don't have any issues with it, then just doing your annual exam and checkup and getting blood work done once a year is fine.
Do you find that a lot of people come in, I get a lot of people in my clinic that are anemic, that are losing their hair?
Oh, yes. I mean, we didn't even talk about telogen effluvium.
Go.
Oh.
Are we okay?
We're fine.
Okay.
So let's finish talking about skincare, and then we're going to move on to telogen effluvium.
Okay.
So cleanser, sunscreen in the morning, and then you can put your makeup on after that, or just go. And then at night is what you use to target when you're concerned about. So if you're concerned about wrinkles, we recommend retinols. We recommend prescription Retin A. We also recommend alpha hydroxy acid. And I think a lot of these products now,
men and women, mind you.
A lot of these products now are combination products. They have everything in them. They have growth factors. They have vitamin C, they have what we call TNS, they have skin lighteners. I mean, you can have these cocktail type of products, especially from your dermatologist, and you can apply that at night. So it does multiple things at the same time. So there are several skincare lines that we recommend, and not every line is for every person. So we do have a medical esthetician, and she actually will sit down one-on-one and go through your skincare and decide what is best for you.
Okay, and then what was we were going to talk about?
Telogen effluvium.
Yes.
Yeah, again, see, that's why it's important to see a dermatologist or someone who specializes in hair, because everybody who has hair loss may have a different cause, and we have to do a workup. And so when I look at my patient's scalp, I have to determine whether their hair loss is a scarring type of hair loss, which is inflammatory, or is it a non-scarring where their scalp looks normal. And there's different hair scalp conditions that occur under this category and certain ones that occur under this category. So the most common type of hair loss in all women and men is hereditary thinning. So the scalp looks normal.
Right.
But what happens is that the hairs are predetermined genetically to turn off and turn from thick hairs into small, fine, vellus hairs, like baby hairs. And so that's triggered by hormone levels as well as genetic factors.
And what about testosterone?
And yeah, that's one of the causes of hair loss.
Did you hear that, guys? Low testosterone.
It's the DHT, which is a form of testosterone, which is blocked. And so what happens is in men, that's the major cause. But in women, it can be another form of non-scarring hair loss called telogen effluvium, which is usually a medical condition or an internal or systemic issue. So a lot of patients, when we examine their scalp and they have diffuse thinning and their scalp is not scarred, it looks normal, kind of like the female pattern and the male pattern hair loss, we do a hair pull test. And that's when we pull the hair, and if we get long strands, usually that means the hair is coming out at the root.
Yes.
And that's telogen effluvium. So you need to do a workup.
Yes.
So we do blood lab testing.
Let me just say, you know, I'm getting excited because I like to know we're doing the right things. Hairstylists, people that are in the beauty industry that is watching this video, that is a prime example of what we're talking about. Doing the right things, doing a consultation with your client to make sure you know exactly what the problem is first before it looks, people are tapping their hearts, before you do a service. Just don't bring people in and start doing their hair or their skin or whatever the case may be. Do a consultation first. You cannot get any service with me or her without getting a consultation first. We have to know what we're working with. Look, everybody's going crazy over that because people don't do it. It's important. And those of you who go to stylists, I don't mean to be negative, or go to professionals and they don't do a consultation, then you need to think twice about going. You need to go somewhere where you're going to get that right service. I'm sorry. I just had to talk about that because that is so crucial.
And that consultation, like I jumped to the physical exam because as a doctor, that's what we do. But that consultation is important. You're getting a history. You know, you want to know about any hair issues they've had before in the past, any medications they're on, any recent illnesses. And when we do the blood testing, you know, we're checking thyroid, we're checking for anemia, we're checking for low protein levels. You know, crash dieting can cause protein deficiency, and your body needs protein, so it takes it from the hair. And so dieting, crash dieting, those
surgery, women who have babies, stress.
Yeah. But there's so many causes, and sometimes in women we can have elevated male hormones, and that's called hirsutism.
Did you hear that?
Of facial hair, but then you can get associated with hair loss from the scalp.
Wow.
It's called polycystic ovarian syndrome, and your body just makes too much hormones, male hormones, in females, and that can trigger hair loss. So there's a whole workup that we do, and we even check for lupus. And lupus, as you know, one of the signs and symptoms of lupus is hair loss. And so we do a battery of tests on all patients who suffer with hair loss because we want to get to the cause and we want to diagnose this patient correctly.
So what we've learned from this is stop diagnosing yourself, number one. Number two, go get consultations. Know what you're dealing with before you get the services. And not every product is for every head. So what we're gonna do, real quick, we're gonna go to questions.
Yes.
All right, so can I see better than you, or you can see better? Okay, so we're gonna take questions. Okay, Bettina said this is great information. Thank you, Bettina. So we're gonna take a few questions, and then we're gonna end. So real quick, while you all are driving, don't do it while you're driving, but those of you who are watching, ask some questions while we have Dr. Calender here. Is there anybody that has any questions? They're probably putting them in now. Okay, type quick if you can. Are we coming in clear? So maybe we tapped on some, it'll probably.
Right there?
Yeah, they, let's see here. Okay.
Keith has his computer.
I have my
iPad?
Yeah,
so
iPad.
Was it computer, laptop? Same thing.
So no, I don't see any questions as of yet. I wonder if we lost, I hope we haven't lost you all, but it's still recording. So listen, okay, what dose of vitamin D should a 50-year-old take?
Well, if you're doing it, if you're wanting vitamin D supplements, mainly just as a just to keep everything healthy and just to do it on a regular basis, 2,000 international units a day is fine. But if you're suffering from vitamin D deficiency, and it depends on your numbers, you may need more. So some patients need 5,000, some need 10,000. So if you need to have higher dosage, I would definitely recommend that you talk to your internist and let your internist be the one to suggest your dosage. But if you have normal vitamin D levels and you're just taking it just to be healthy, I think 2,000 international units that you take every single day is fine and adequate.
Okay, someone said, what type of foods or supplements do you recommend for hair growth?
Well, I don't really recommend different diets or nutritional foods for hair regrowth. I don't really have any, but I will say that you know, any type of vegetable, leafy vegetables, green, colorful vegetables, I say, is really good for your skin as well as your hair. And I will say that drinking water is really good for hydration of the skin and hair. And I think you need to make sure that you drink lots and lots of water. And I know for patients who suffer from acne, we actually recommend topical vitamin A, which is retin A, but in your diet, lots of carrots, and carrots are really good for the skin.
Someone said dark circles. What do you recommend for dark circles under the eyes?
Oh, that's hard, that's difficult. Just like with hair loss, dark circles are caused by multiple factors. So it's not just dark skin. And a lot of times what we have to do is stretch the skin and see if the skin is normal color or is it dark. If you stretch the skin and the skin is dark, then that's hyperpigmentation. You can use 2% or 4% hydroquinone, which is a skin lightening cream, and you can use that to help lighten the area. But if you stretch the skin and the skin is normal, most likely the cause is due to the thin skin under the eyes as well as the blood vessels. And then because it's thin, it's depressed and there's a shadow. So really, dark circles really is not dark skin. It's usually due to the anatomy of the skin surrounding the eye. So you have to plump up the skin, make it nice and full. Sometimes we use fillers, hyaluronic acid fillers that we use for lines and wrinkles. We actually put it under the eyes to help to camouflage the area, and then a good concealer.
Now, I notice sometimes when I get bags under my eyes, I start drinking more water. It's an indication that I'm dehydrated. Is that true?
Well,
like puffy eyes?
Well, I mean, everybody's different. So
okay,
yeah,
okay.
So some people, the skin gets edematous and it swells up with their allergies, and especially you know, during the springtime, and rubbing the eyes can cause thickening and darkening of the skin. So there's a lot of different reasons to have dark circles and puffy eyes, and that's why you need to see a professional.
Someone said, how often should a laser be used?
A laser for hair loss or laser hair removal? I mean, we do lasers.
Yeah, we got to find out which laser you're referring to.
So most likely it's due to the laser that we talked about earlier, the Theradyne. Well, it needs to be done 20 minutes, 2 to 3 times a week. And it's a helmet that you just sit on your scalp on top of your head, and you just can do it while you're at home. And we do recommend the treatments at least 2 or 3 times a week. And then that's maintenance. And it's something that you purchase, and then you take that home, and you do that in between your PRP treatments.
Excellent, excellent. Okay, so I'm going to take probably one more question, and I want to thank you for taking the time on a Sunday afternoon. I mean, she just flew in yesterday, and then, you know, we've been going back and forth because her schedule is so crazy busy, but I want to let you know I appreciate you. I've been watching you for over 30 years. Do you remember, what was that place called at the Four Seasons? Desiree?
Desiree.
That was when I was 15 and I snuck in. And we had our friends like Adine and all of them. We used to hang out, and oh my God.
Yeah, that was an elegant, beautiful
And she
place.
still looks the same.
Oh, thank you.
But I want to thank you. I've watched you a long time. You inspire me. When I was young and didn't have a lot of money, and I would just come up and talk to you, and to see with your business the growth, who you are and what you do and how you give back, and what you do to help people. And I just want you to know that you're appreciated. I appreciate you doing this. There are several people out there that watch you, that appreciate you. And thank you just for being present in the community, because you're just incredible. You're just incredible.
I'll tell you, skin and hair is my passion.
Yes.
And it's yours too.
Yes, ma'am.
Okay,
Yes,
so
ma'am.
that's kind
Yes,
of why
ma'am.
we're doing this
Yes,
together.
ma'am. Yes, ma'am.
And it's just something that is just very important to me.
Yes.
It helps with self-esteem. It helps my patients lead active professional lives, and it's just something that I do every day, and I don't even think about it.
And it literally, she doesn't think about it. The answers just flow out of her mouth. It's crazy. Well, listen, thank you all so much for tuning in today on your Sunday afternoon. I know some of you all are at church. Patrick Green said, thank you. Appreciate both for bringing this to the forefront. Casey said, what type of diet of Casey, what you do is when you go in the, go back to the video, and you will be able to see a lot of those answers. The question that you're asking right now. But listen, I want to thank you all for tuning in. Dr. Calender and I are going to have some discussions of some things that we could do in the future. But those of you who want to come to her event here in the DMV area, which is here in Maryland, and that telephone number again is
301-249-0970. We're in Glendale, Maryland, 12200 Annapolis Road, Suite 315.
And a lot of the people that, if you have questions or about the products that we use, or my product that I have, her product that she has, you can call me at my clinic at 1-844-HAIR-DOCTOR-1. You didn't know I had that now.
No,
anyway.
I did it.
So listen, thank you all so much for tuning in. If you have more questions, just put it in the timeline under the video. If you could do us a great favor, share this video with everyone. Go to Dr. Calender's website. Go to her Instagram page and her Facebook page. She's on there, and send her your questions. See, how big is your staff? You have a huge...
We have 15
people. This place is huge.
And we're all here to help.
Oh my God, this place is huge. Anyway, have a fantastic day, and thank you for tuning in.
Bye.
Take care. Bye-bye now.